And while the holidays are time to get together with family and friends, it's also a time many people experience loneliness. A study in the National Library of Medicine found loneliness affects half of adults over the age of 80 and 71% of adolescents and young adults. Dean at Columbia University School of Public Health, Dr. Linda Fried, is joining me now for more on this and what you can do to help. Dr. Fried, thank you so much for coming on. Let's talk loneliness here. What are some loneliness symptoms that people experience around this time? Because being alone and being lonely is not the same thing.
Yeah, no, that's definitely true. So what's loneliness? Loneliness is a feeling. It's a subjective feeling, and it's painful. And it's a pain coming from feeling like you don't have meaningful relationships and your needs are not getting met in the relationships you have. Sometimes people don't see other people very much, but sometimes they do, and they're still feeling like they have no close or best friends or people they're intimate with. When loneliness gets prolonged, people have it for a long time, you can develop follow-on symptoms like having more difficulty connecting with other people and even interpreting others' intent in talking to you more negatively than other people might. And it can create a very vicious cycle where you start avoiding those interactions because they are creating bad feelings in you. And these stem from prolonged loneliness.
So what are some small but effective ways to address that, right, in ourselves, or if you see someone else that you care about and you think they're feeling this way?
Yeah. So I think I like to think about loneliness as like hunger. So when we're hungry, it's our body telling us that we need to get something to eat. When you feel lonely, it's our body again and our mind telling us we need more connection. That's meaningful. And there are some things we can do for ourselves and some things others can do for us to help. For yourself, you should recognize the feeling and think about how you can act on it. And there are a range of ways to do that. Certainly being good to yourself, treating yourself with taking a walk each day, but also creating your own traditions, inviting people over or to get together who you'd like to hang out with can be a gift to them as well as to you. You can also actually look to have other kinds of ways to connect, volunteer, help at a food kitchen, go and join a walking club, join activities that you love, that you would love to engage in with others that are around your community. And through those, you can build new social interactions while also doing something you totally enjoy. For people who look at someone they know and care about and think they might be lonely, there are things you can do too. Make a phone call, have a Zoom call, invite them over for dinner or brunch, or just ask them if there'd be something they'd like to do together. These are all real gifts. I think the other thing is to think together. So human beings historically have survived in communities where people actually do have more connection than we currently do in our country and around the world. And so we could think together about how to build more organizations, more activities that bring us together around things we care about, where we can connect in a meaningful way.
Dean at Columbia University. I'm
critical.
sorry, Dr. Fried, thank you. It's such great advice, and I think something we often forget about, especially around the holidays, not only looking at others' loneliness, but even our own, because sometimes, again, you can be surrounded by people but still feel lonely. So thank you so much. Such an important topic. Dean at Columbia University School of Public Health, Dr. Linda Fried, thank you.
Thank you. Take care.
You too. And if you or a loved one is struggling with mental health distress, including thoughts of suicide, substance use, or emotional distress, text or dial 988. Free help is available 24/7.